The COVID-19 pandemic has changed how each of us interact with the outside world, including healthcare. At Mass General Hospital for Children, we are ready to care for your children, whatever their healthcare needs may be. Our Safe Care commitment ensures we provide the very best and safest possible care for all our patients. Your child's health is our #1 priority, and we have taken unprecedented steps to ensure that our patients and community are safe. If you're wondering whether your child should come into the hospital for an appointment, I urge you to call your provider's office directly. Our doctors and nurses will help you decide what's best for your child. It's possible a virtual visit makes the most sense, or we may need to see your child in the office to provide the safest health care to him or her. Many of our specialists are seeing patients in our community locations as well. And if your child has a fever or respiratory symptoms, you may be asked to come into our specialized respiratory infection clinic. This is a special location in our hospital where we're able to provide care to those with fever or other infectious symptoms while keeping all other patients and staff safe through the use of additional personal protective equipment.
As part of our Safe Care commitment, Mass General Hospital for Children is screening all patients and visitors on arrival to protect them, their families, and our staff before they are admitted to a clinic or infusion space. You will be greeted by a Mass General employee who will provide you with hand sanitizer and a mask and will direct you to your appointment location. You may be asked multiple times about any symptoms you may have. Please be patient, it is for your safety. Admitted patients are tested prior to admission and screened daily. Outpatients are screened prior to and upon arrival, and if symptomatic, are cared for via virtual visits or in designated areas where we use CDC recommended personal protective equipment, or PPE, to prevent spread. We have added more hand sanitizer stations around the hospital so that you and employees can clean and wash hands frequently.
At the Mass General Hospital for Children, family-centered care is the cornerstone of the care that we provide. No parent or guardian is considered a visitor. Parents and guardians are encouraged and allowed to come together with their children to their appointments. If you're wondering what it'll be like to come back into the hospital, I want to reassure you that we have many safeguards in place. There's a pre-check-in option available through Patient Gateway, and when you come into the office, you will be safely spaced from our front desk staff, and in most of our offices, there will be markings on the floor or a plexiglass screen to keep you and the staff safely distanced from one another. When you arrive, keeping you and your child safe is our top priority. When you come in, our waiting rooms will look very different. We have many fewer chairs and they are spaced at least 6 feet from one another. And in most cases, patients are put immediately into rooms. Once you're in a room, you will notice that staff are wearing masks, which all staff and all patients are asked to wear. You will also notice that many staff have goggles or face masks to allow us to examine patients who aren't able to keep masks on, or if we need to look in their mouth or throat. We understand your concerns about seeking care at this time, and we want to assure you that everyone at the Mass General Hospital for Children is here for your children and your family. We encourage you to stay in close communication with your child's care team via Patient Gateway or calling the Patient Access Line at 888-644-3248. Do not delay contacting MGHFC for an appointment, particularly if your child has a serious or chronic illness or new problem that requires ongoing care. Our dedicated physicians, nurses, and staff are here to provide your child the very best health care safely and effectively.